Hello everyone, I am urologist Omar Makaya. Today I will talk about varicocele and premature ejaculation. Is there an improvement in premature ejaculation after varicocele surgery? There is an article published last week about this. It came out of Turkey, a scientific article. They evaluated 82 patients who underwent varicocelectomy in terms of premature ejaculation. Testosterone, sexual intercourse ability, erection ability were checked before the surgery. These patients underwent varicocele operation due to infertility. I had previously read many publications showing that varicocele surgery increases testosterone, sexual power, and erection ability. But I had not read any publication that it could be good for premature ejaculation. After the surgery, erection questionnaires were conducted to see the erection ability, and intravaginal erection time was evaluated. The results are very good, frankly. After the surgery, an increase in testosterone, an increase in erection ability and an improvement in premature ejaculation were detected in the patients. All of them were considered statistically significant. Currently, in urology, a varicocele operation is not performed to treat a patient with varicocele who also has premature ejaculation and erectile dysfunction. In other words, varicocele operation is performed due to testicular pain, scrotum pain, or infertility. But we know that there are many scientific publications that are really compatible with this publication. After the varicocele operation, we see that there is an improvement in testicular function, sperm quality, testosterone amount, erection quality, and with this publication, we see an improvement in premature ejaculation. Why do these improvements occur? Because varicocele is a disease that disrupts the nutrition, blood supply, oxygenation and hormone production in the testicles. It dilates the veins and sends the dirty blood that should be collected from those veins and sent to the heart back to the testicles. Because the dilated vessels lose their function, that mechanism starts to deteriorate. But as I said, this is recovered with varicocele operation. We have made videos about the varicocele operation before on how to do it. We definitely use microdoppler in our protocol. At the same time, we perform the varicocele operation by seeing and evaluating the field larger with a microscope. At the same time, before the operation, I definitely look at the Doppler ultrasound in my own clinic and evaluate how many arteries there are in the cord, how many of them I need to protect. Because arteries are very important. When we tie the arteries, new ones cannot form again. These are the vessels that feed the testicle, the vessels that bring blood to the testicle. At the same time, when we perform the surgery under a microscope, the possibility of hydrocele is much less. There is also less chance of recurrence. In general, this is our video about varicocele and premature ejaculation. Thank you for listening.